So we've been discussing the goals of therapy and escalation strategies, but I know it's important to you, the importance of lifestyle modifications, self-management strategies, and why you find that important, and then how lung function impacts people's ability to go through their daily lives.
So the lower the FEV1, the worse lung function, the more symptomatic someone will be, and oftentimes the more limitations they are. The problem is that there's a tremendous amount of variability. So you can have two people with the exact same FEV1, and some people function better than other people do. Some of that has to do with their other comorbid conditions. So if you have someone with the same FEV1, but one person has arthritic limitations in their legs, they're going to be able to do less than someone not. No one cares. I don't have a single patient who cares what their FEV1 is. They care about how they breathe and how they function. And our job is to maximize what they're doing with their lives. If part of that is improving the FEV1 if we can, much of that is improving their level of function, which can be partly medicines and partly exercise programs and other things.
Yeah, so one other, you can actually objectively measure FEV1 is important, but it isn't everything. And you can objectively measure the air trapped in their lung at the end of a breath. And while FEV1 often reflects, when that improves, less hyperinflation and less air trapping, there's many circumstances and well-done studies showing that you can get deflation in the absence of improvement in FEV1. And it winds up that degree of hyperinflation, the barrel chest overinflated, not able to exhale completely, correlates with shortness of breath more closely than FEV1. So FEV1 is relevant, but it is not everything. And if we get improvement in quality of life parameters independent of FEV1 or disproportionate to FEV1, it's probably meaningful.
And are you able to get access to some or any of this data in terms of trying to make formulary management decisions, whether it's in the whole or whether it's patient by patient in terms of whether they can escalate therapy?
Well, I think now with the apps and the newer tools, it'll be interesting to see. I mean, in heart failure, we've been tracking patients, right? With telehealth, we can track their weights and symptoms, and that comes together into an algorithm that is more timely, meaningful, actionable in terms of a protocol. It would be interesting as we start gathering data from apps and how this can integrate with care managers, for example, a respiratory therapist, so that between office visits, maybe there's a better assessment, but if this can tie to a protocol or even a referral process where needed to a pulmonologist, I think that's the exciting part. And I have to believe that it is, in the end, I think as we look at new therapies that are coming forward, pharmacotherapies, it is more than FEV1. FEV1 is objective, but how patients are feeling, shortness of breath, that ultimately leads to, it's the tip of the iceberg with everything underneath, shortness of breath, how they're functioning, that's going to escalate to resource utilization, ER visits, and ultimately total cost of care.